If you're experiencing symptoms of menopause like hot flashes, sweating, and vaginal dryness, Eemt might be prescribed by your doctor. It can help reduce these symptoms by replacing the hormones that your body is no longer producing. Eemt is a combination of estrogen and methyltestosterone, and it's used for short-term treatment. If you're only experiencing vaginal symptoms, your doctor may suggest using products that are applied directly inside the vagina before considering medications that are taken orally, absorbed through the skin, or injected. Before you start using this medication, make sure to read the patient information leaflet from your pharmacist. Take it by mouth as directed by your doctor, usually once a day for 21 days followed by no medication for 7 days. You can take it with or without food, but taking it with food can help prevent stomach upset. Remember to take it at the same time each day as directed. And make sure to tell your doctor if your condition does not improve or worsens. You may experience dizziness, lightheadedness, headache, stomach upset, bloating, nausea, weight changes, increased/decreased interest in sex, or breast tenderness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Remember, this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as signs of liver disease, mental/mood changes, breast lumps, swelling of hands/feet, unusual vaginal bleeding, changes in skin color, unusual tiredness, or worsening of seizures. Women may also experience signs of masculinization from methyltestosterone. If you notice any of these changes, stop taking the medication and contact your doctor immediately. This medication may rarely cause serious problems such as heart attacks, stroke, and blood clots. Seek medical help immediately if you experience symptoms such as chest pain, sudden severe headache, weakness on one side of the body, trouble speaking, sudden vision changes, pain/swelling of legs, trouble breathing, or sudden dizziness/fainting. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. Estrogens can sometimes cause serious side effects when used for replacement therapy after menopause. They have been reported to increase the chance of cancer of the uterus, but taking a progestin with estrogen decreases this risk. Tell your doctor right away if you have any unusual vaginal bleeding. In postmenopausal women, estrogens, taken with or without a progestin, increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens also increase the risk of heart disease. This medication should be used for the shortest possible length of time at the lowest effective dose. Discuss the details with your doctor and check with him/her regularly to see if you still need to take this medication. Products that contain estrogen should not be used to prevent heart disease or dementia. If you use this drug for an extended period, you should have a complete physical exam at regular intervals as directed by your doctor. Before taking this medication, it's important to let your doctor or pharmacist know if you have any allergies to methyltestosterone or estrogen, or if you have any other allergies. This medication may contain ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, it's important to tell your doctor or pharmacist about your medical history, especially if you have a history of certain medical conditions or disorders. It's important to let them know about any conditions such as diabetes, high blood pressure, heart disease, kidney disease, or if you are pregnant or breastfeeding. If you have diabetes, it's important to monitor your blood sugar levels regularly while taking this medication and report any symptoms to your doctor. This medication may also cause dizziness, so it's important to avoid alcohol and marijuana while taking it. It's also important to be cautious in the sun, as this medication may cause dark areas on your face and skin, and to avoid smoking while taking this medication as it can increase your risk for certain medical conditions. If you will be having surgery or will be confined to a chair or bed for a long time, it's important to notify your doctor beforehand as special precautions may need to be taken. This medication must not be used during pregnancy, as it may harm the unborn baby. It is also not effective for preventing a miscarriage and should not be used for this purpose. If you are breastfeeding, it's important to consult your doctor before using this medication. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Eemt include anastrozole, blood thinner, warfarin, corticosteroids, such as prednisone, exemestane, fezolinetant, aspemifene, raloxifene, tamoxifen, and tranexamic acid. Other medications can affect the removal of estrogens from your body, which may affect how Eemt works. Examples include azole antifungals, such as itraconazole, macrolide antibiotics, such as erythromycin, rifamycins, such as rifabutin, St. John's wort, and drugs used to treat seizures, such as carbamazepine, phenytoin, among others. It's also important to note that Eemt may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone takes too much Eemt and has serious symptoms like passing out or trouble breathing, they should call 911. Otherwise, they should call the Poison Control Center right away. U.S. residents can call their local Poison Control Center at 1-800-222-1222. Canada residents can call a provincial Poison Control Center. Symptoms of an Eemt overdose may include severe nausea/vomiting and unusual vaginal bleeding. When taking Eemt, it's important to remember not to share this medication with others. Make sure to keep up with regular physical exams and medical tests while you're taking this medication. Follow your doctor's instructions for examining your breasts and report any lumps right away. Also, be sure to keep all medical and lab appointments. You can make lifestyle changes to help control or prevent high blood pressure, high cholesterol, and diabetes, which can also help prevent heart disease and strokes. Keeping your mind active with mental exercises can help prevent dementia, so discuss any lifestyle changes that might benefit you with your doctor. To manage hot flashes, try to keep a cool body temperature by using a fan, drinking cool beverages, dressing lightly, and avoiding hot/spicy foods. Limiting caffeine and alcohol, exercising regularly, and learning relaxation techniques may also help reduce hot flashes. And if you experience discomfort during intercourse, vaginal lubricants can help lessen it. If you forget to take a dose, take it when you remember. If it's close to the time for your next dose, just wait and take it then. Don't take extra to make up for the missed dose. Keep Eemt at room temperature, away from light and moisture. Make sure to store it in a safe place where children and pets can't reach it. When it's expired or you no longer need it, ask your pharmacist or local waste disposal company how to properly get rid of it. And remember, don't flush it down the toilet or pour it into a drain unless you're told to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.